Okay. Well, good afternoon, everyone. Thank you for coming to downtown Calgary here, the location of Canada's largest recovery capital conference, hosted here in a beautiful city of Calgary. I'm incredibly pleased to be letting you know about an increased cooperation that Alberta, Saskatchewan, Ontario are going to have going forward surrounding our response to the addiction crisis and mental health at large when it comes to focusing on recovery-oriented systems of care. Today's press conference announcement follows earlier this week where Alberta announced a $1.13 billion focus on mental health and addiction in the new Health Organization of Recovery Alberta, and also the evidence-based policy-making evaluation organization of the Canadian Centre of Recovery Excellence. Today, we are on the second day of the largest recovery capital conference in Canada's history, where 2,000 Canadians and international participants have come to Alberta to share stories, to learn best practices, and focus on the best way for us to move forward, focusing on how to get recovery into our healthcare system, into our communities, and respond to the deadly disease of addiction. I'm happy to say that approximately half of those participating in this conference this year are Indigenous. It's an important partnership that the Government of Alberta has had with our Indigenous partners to the extent of funding 5 recovery treatment centres with Indigenous partners, 4 of which are on reserve with Tsuut'ina, with Enoch, with Siksika, and with Blood Tribe. And obviously we plan to continue moving forward in these partnerships and sharing best practices that we learn from partners across other provinces, including my colleagues here today. So with that, I'm going to invite up Minister Tibolo from Ontario to share some comments as well.
Thank you, Minister. Good afternoon, everyone. It is a real pleasure for me to be here this afternoon, joining my colleagues from Alberta and Saskatchewan to talk about a concept that's extremely important in Ontario as well. You know, when first elected, we made a commitment to look at building a recovery-oriented system in the province of Ontario to meet people where they were, but to make sure they got the supports they needed so that we would be able to support them and get them back to their communities in a way that would allow them to live the lives the best way possible. The investments that the province has made to date, over $525 million in annual financing to support these, as well as an additional $90 million to build a addiction treatment recovery program. And with that, we've opened 400 beds, 7,000 treatment spots. We, like Alberta, believe and support people that have addictions and want to meet them where they are. It's extremely important that we do this and support individuals with the kind of supports and services they need to improve their lives and to be able to become functional, to be able to rejoin society. And with that, I want to say thank you to the Minister for inviting us to come to the conference. It's overwhelming to see so many people here, and in particular to see Indigenous communities, because in Ontario, we also face issues trying to resolve issues in the Indigenous communities. And the collaborations that we're establishing, similar to what is happening in Alberta, are making a world of difference in providing supports and services that are culturally safe and that are based on line-based healing. So it's wonderful to be here with my colleagues. We're going to continue collaborating in the hope that we build a system that will not only serve the 3 provinces that we represent, but also the entire country. And with that, I'd like to turn it over to my good friend, Minister MacLeod from Saskatchewan.
Thank you very much, Minister Tibolo and Minister Williams, and welcome everyone. I'm pleased to be here. Quite an honor to work alongside my counterparts from Ontario and Alberta as we work collaboratively towards the common focus of recovery-oriented systems of care. In Saskatchewan, we introduced our action plan for mental health and addictions last October, and there's 3 pillars to that plan. One is to expand capacity, adding more than double the existing treatment spaces across the province, across the entire continuum of care that individuals may need. The second pillar of that plan is to improve access to those spaces, and the third pillar of that plan is to transition our addictions treatment system to a recovery-oriented system of care. And of course, that's what we're all here doing, talking about this wonderful conference, and I want to thank Alberta and the City of Calgary for hosting us. It's been just a wonderful opportunity to hear lived experience and hear from so many experts all working towards a common purpose, and very excited to continue to work together with the province of Alberta, the province of Ontario, and all the other partners who are embracing the recovery-oriented systems of care. Mr. Williams?
And with that, we're happy to take any questions that you might have. I'll turn it over to Mr. Barrell to navigate.
All right. Well, thanks, everyone. Thank you, ministers. We'll start with questions in the room. Sorry, this mic is a little low. If you can just state your name and outlet to begin, and then we'll do a question and follow-up to start. Go ahead.
Sure. Alana Smith, Globe and Mail. Minister Williams, I just wanted to ask you a bit about comments that were made yesterday by Marshall Smith during the presentation in the evening. One of the comments he made is that he said that there can be improvement in Alberta for harm reduction services. Can you expand on that, services specifically, and if you're working towards that?
Yeah, absolutely. In our budget, we afford millions of dollars a year when it comes to services that reduce harm. Good examples of this, naloxone. We distribute over $3 million worth of naloxone kits across the province at no charge to anyone. It's an important key pillar and plank when it comes to Alberta's path forward in a recovery model. VODP as well is something that's very important for us to continue to expand. And we're very open to more policy solutions. We can go on about the DOORS app and many others. There is room for improvement, of course. We see a crisis on our hands. When it comes to something like harm reduction, it plays a part in our model, of course, but if you're talking not about harm reduction, but instead the harm production policies of, say, safe supply, that's something Alberta has made illegal. We will always oppose, and that needs to be abundantly clear and make that really important distinction, that if you're no longer reducing but producing harm, then we in the province are going to oppose that.
Sorry, my question wasn't about which policies you're opposing, like safe supply in British Columbia, but what policies can be improved here in Alberta specifically? Are there new harm reduction measures that are coming forward, or are we just expanding the ones that we currently have?
I'm always looking to reform and expand what we have and what works. An important part of this conversation is going to be what CORE, the Canadian Centre of Recovery Excellence, is able to do in evaluating our system. We need to have an honest, data, evidence-driven approach when it comes to what's working, what needs to be reformed. So as CORE gets stood up, if the legislation passes in the legislature this spring, we're going to be working this summer to get in the administration and the experts and be partnering with institutions so that we can look at the data and say what is working. And from there, I'm very happy to use evidence-based knowledge to say, where do we need to go from here?
I'm hoping we can count that as a clarification to my first question.
Sure,
One
go
more.
ahead.
We'll go
Very
to the next
happy.
one.
Yeah.
I wanted to ask you a follow-up from some of your comments on Tuesday about the My Recovery program. I understand the data isn't publicly available, but I'm assuming that you've been able to see that data. Can you give us any sort of indication of what it suggests in Alberta about wait lists, about outcomes, anything like that?
So in Alberta, we have a very strict regime when it comes to data and the use of it. What we want to do in the province is make sure, for the purpose of policy and informing our decisions as a government, that the right data is in the right hands of the right people at the right time. And so that's some of what this upcoming legislation that will soon be introduced is going to help us do. So I have not seen full data sets yet because we need to make sure we have the appropriate privacy impact assessments done. We're following that highest standard. While we get the data into the right hands of the right people at the right time for policy, we need to make sure we're protecting that privacy too. So as that is sorted out and the custodianship is finalized with Recovery Alberta, et cetera, then we're going to be able to move forward and get that data transparently available to people who need access to it, including the public in appropriate ways.
All right, we'll move to our next question in the room.
Jillian Code with City News. With this collaboration with Saskatchewan and Ontario, is that a collaboration of sharing ideas, sharing resources? What does that actually look like?
Well, I'll start and I'll welcome up my colleagues as well to add. It really is a sharing of ideas to start. Canada has had a lively discussion surrounding our path forward, especially when it comes to addiction. And the recovery model and the recovery-oriented systems of care are an important piece of what a policy alternative looks like and how we can improve getting people out of that deadly disease of addiction and into healthy and healed relationships, back as community members and family members, mothers and brothers again. And so there's a lot of work that needs to be done between different ministries within my government, between different organizations like Recovery Alberta and the Canadian Centre of Recovery Excellence, but then also between provinces. And the idea that we have collaborative partners across provincial boundaries, to me, just seems deeply appropriate. A huge piece of partnership for me is partnership with our Indigenous partners and taking that very seriously, not imposing solutions on them, but instead proposing as partners together what the path forward looks like. I'd like to see more of that sense of partnership rather than imposition from the federal government when it comes to provincially, constitutionally provincial responsibility in healthcare. This is the start of what that can look like in a positive collaboration. And I'm inviting anyone that wants to be a part of the Recovery Coalition, that wants to see people out of that deadly disease of addiction, to be a part of our team in this broadest sense.
Do you have a follow-up, Jillian?
Well, I might offer my
sorry.
colleagues.
Just very quickly, one of the things that doing this kind of work, and we share this experience, mental health and addictions is always stigmatized. It's stigmatized in the family, it's stigmatized in the community, it's stigmatized in the government. And a lot of times the way we get over that stigma is by collaborating and talking, learning from each other, doing jurisdictional scans, and not having to repeat the mistakes that perhaps are the part of the growing pains as systems get established in other jurisdictions. So looking at places like Portugal, look at what is being done in Alberta in a very positive, proactive way, gives us the ability to have this open dialogue and talk about mental health. Because if you think about it, 5 years ago, 10 years ago, we would never have a press conference with media present and ministers getting together and over 2,000 people in a room wanting to talk about what we can do to help people. So I think this is extremely important work, and these kinds of collaborations hopefully will start building that wave of effort forward that hopefully will become a tsunami. We're going to help a lot of people, not just in our 3 provinces, but across Canada.
Yeah, I would echo the comments of my colleagues. I think, addictions know no boundaries. They don't stop at the borders. And so the fact that we can collaborate in a unified purpose, in a unified direction, and the path to recovery is a lifelong journey for individuals. So when individuals are walking that path, they may cross those boundaries, they may cross those borders into the neighboring provinces. And if we have a unified approach where we're all focused on a recovery-oriented systems of care and recovery model, I think that is better serving the people that are using those systems.
Now we'll go to a follow-up.
Just regarding the data from this recovery model, is there a timeline?
Yeah, legislation is being introduced this spring, and once that legislation's passed and we've done the appropriate impact assessments for privacy and worked through with the Privacy Commissioner and relevant stakeholders what this can look like, then we'll be seeing how we can appropriately, in an aggregated way, in a depersonalized way, use that data for public policy with the highest standards.
Just to clarify, sorry, would it be appropriate to say that this time next year we will have those numbers, or is it?
Yeah,
completely
I would
up in the air?
hope so. Yeah, I would hope so.
All right, we will move to the phones now. Operator, can you put through our first caller?
Our first question is from Shailen Skalski, CTV. Please go ahead.
Hi, thank you so much for taking my question. I'm just wondering, what data are you drawing from that supports Alberta's recovery model is working? Looking at the provincial data, we see deaths from all substances increased by about 130% since the UCP took office. Now, part of that increase could be, of course, the pandemic, but the crude rate per 100,000 people for opioid deaths from 2022 to 2023 post-pandemic is also up 25%, marking the steepest increase in Canada. So I guess, how do we know your approach is working?
Yeah, thank you. Great question. So first off, we're informed by the literature. We have the world's foremost expert, Professor Keith Humphreys from Stanford University, who authored the Stanford Lancet Commission, a report published in Lancet, the world's preeminent medical and science journal, that informs our policy. So it is evidence-driven in that sense. And we have been in Canada in a policy setting for the last 20, 30 years that only saw one way of thinking of this. And recovery now, as a model that's being instantiated here in Alberta and in other parts of the country, as we see with my colleagues, we are now starting to see for the last 4 or 5 years, in spite of the pandemic and the crisis, we're starting to see it implemented. We have 2 out of 11 recovery communities that are operational, only one of them fully operational in terms of the capacity, the others building to that in Lethbridge. We have a lot of work to do in partnership with the First Nations. And so as the system gets built, we are going to continue to see more progress. But it's important to note that whether you're looking at pharmaceutically prescribed opioids, deaths related to those are down. Alcohol death related to that, those deaths are down. Deaths related to cocaine is down. Methamphetamine is down. So we have to also recognize that addiction to opioids and the crisis we see, especially in the public display in the streets, is something we have to work on. But we also recognize that addiction is broader than that and that we are seeing strides forward. So let's continue to work on recovery, because the alternative to recovery when someone is in addiction is letting them continue to stay in that addiction. And I just, from my perspective, I can't let somebody who's struggling with the deadly disease of addiction just simply maintain. I want to see them helped. I want to see them healed. I want to see them come through the other side to be members of our community again.
Do you have a follow-up, Shalane?
Yeah, I'm hoping you can tell me a little bit about CORE, the Canadian Centre of Recovery Excellence. Will it be a public body or a private corporation? Also, the mandate of the organizations, will it be looking solely at recovery-focused treatment options, or will harm reduction measures also be explored?
Yeah, it's a public body. It's a Crown corporation. It's equivalent to what already exists in Alberta under the Health Quality Council of Alberta. And that body is also a Crown corporation. And its purpose, its mandate, is to, first of all, review and evaluate our mental health and addiction space. And within that includes all sorts of measures that we currently have. That would be drug consumption sites, naloxone distribution, virtual opioid dependency, recovery treatment centers, detox spaces, pre-recovery housing, post-recovery housing. The list goes on. That's just to name a few. And it will be able to look at the application of these policies, review and evaluate, collaborate with bodies for research, and make sure that we are doubling down on the policies that work and help heal Albertans and reforming those that need to be reformed.
Perfect. And operator, can you put through our next caller?
The next question is from Jonathan Bradley, Western Standard. Please go ahead.
Hello, Minister Williams. Thank you for taking my question. You've spoken a ton since you've become a mental health and addictions minister with this committed language on how you have a moral obligation to help these people and that you don't want these people to suffer from addictions longer, you want them to seek treatment. What motivates you to keep fighting?
Pardon me, could you repeat the question? Just that last line?
What motivates you to keep fighting?
Oh, well, I think that it's in the Canadian character to want to help those who are vulnerable. To me, growing up in Alberta, not different from any part of Canada, there's a sense of love of your neighbor, a sense of obligation and of care for the dignity of every single Canadian, every single human. And I get to meet and talk to individuals that are going through a crisis. I get to talk to men and women. I get to talk to, unfortunately, boys and girls who are in the throes of addiction and see despair ahead of them. And if they continue down this path, they almost all tell me they believe that they'll be dead. But it's recovery that gives them hope. It's the opportunity to be a brother or a mother, a father or a son again. And that, I think, is inspiring to every Canadian. It's deeply embedded in who we are as Canadians, to want to care for the vulnerable. And so I do think there's a moral dimension to how we need to approach the addiction crisis. I think it's incumbent upon all of us. And I'll say, even those who disagree with me politically on policy X or Y, I do not doubt the sincerity that they hold in wanting to care. And I think if we recognize that first and foremost, as we address this, that we share a common desire to see people healed and healthy in spite of any policy differences, I think our recovery system and our healthcare system is going to be better for it.
Do you have a follow-up, Jonathan?
Okay. Yes, and my follow-up is for Minister Tibolo and Minister McLeod. So we've heard talk about unique chemical identifiers for safe supply. Minister Williams, I asked you last week about where you stood on that, and you offered your position. Minister Tibolo and Minister McLeod, where do you stand on unique chemical identifiers for safe supply?
Well, this is something that I know Alberta had requested of the federal government in correspondence. I've had conversations with the federal minister as well. I think it's an important way for us to gather data as to where some of that safe supply or safer supply or hydromorphine, anyways, pharmaceutical grade hydromorphine exists in the province of Ontario. There are several programs that are running in Southern Ontario, but we've seen trends in Northern Ontario where individuals are overdosing on pharmaceutical-grade hydromorphine, and there's no way for us to understand where or how those drugs are getting into the northwest of the province. So I think something along the line of having a trace element in a substance that is being supplied in one part of the province but finding itself somewhere else will go a long way in helping us understand how we can better ensure, if these types of use are going to continue, how they're getting into the hands of some of these individuals and how they're moving through the province. So I think it's an important piece of any work that we do to try to ensure that the supply is being used by the person that it was intended for and not for someone else.
And I would just say, Saskatchewan doesn't offer publicly funded safe supply, but we certainly support our neighbors in other jurisdictions in this pursuit, so that any illicit drugs, any illegal drug trade can certainly be tracked for information purposes. As I said earlier, we know addiction doesn't stop at the borders, and neither does the drug trade. So this is certainly something that Saskatchewan supports as other jurisdictions, including Alberta, pursue. Thank you.
All right, operator, if you can put through our next caller.
Next question is from Catherine Grzkowski, Alberta Today. Please go ahead.
Hi, thanks for taking my question. So you mentioned that there's only one of the 11 recovery communities fully operational, and there were a few news conferences today, and one of the criticisms from one of the people speaking at the news conference was that putting all your eggs in the recovery basket when there isn't that access yet is not going to work. It's not helpful if people are waiting so long to get into recovery. There needs to be something in the meantime. What would you say to that?
I would say, if they say the concern is that there's not enough access right now, the solution is definitely not stopping, delaying, or not funding more recovery spaces. If you want to come to the end result of having seamless access without barrier, we have to invest at some point. And as far as I'm concerned, that time was yesterday, because lives hang in the balance. So I appreciate criticism that we need to build as quickly as I can. I'm driving the Minister of Infrastructure nuts as I get as close as I can to pushing the limits of the rules we have to follow to get these projects out the door and built and up and running. So we need to invest in this. I would reply to anyone who says there's not enough access. And would have been great to have done it a decade ago, but we know what we know now. The conference of 2,000 individuals upstairs, and the panel we had on Indigenous recovery made the point and drove it home in an emotional conversation with a number of First Nation leaders. And every time I go and speak to a chief of a First Nation, anytime I speak to those working in the front lines at a First Nation, they're begging and pleading for more recovery access. Not one of them has said, please bring a drug consumption site or safe supply onto my reserve or into my communities. They all ask for that. But I will add, we have immediate same-day access, the only province in Canada, the only jurisdiction I know of in the world, serving over 8,000 Albertans with their virtual opioid dependency program. Evidence-based opioid agonist therapy for immediate relief from withdrawal and from the desire to continue seeking when it's in the Sublocade form for a month. That is a terrific use of technology that we have leveraged to a wonderful immediate access. We have a number of different what people will call harm reduction services within our policy. But if by code, when they say harm reduction, we need more, they mean to say drug consumption sites on every street corner in our cities, and they mean to say dollars spent from the taxpayer's purse into supplying drugs that are 5 times more powerful than heroin, then I oppose that. That's no longer harm reduction. That's clearly harm production.
You have a follow-up, Catherine?
Yeah, so I guess I understand. It sounds like you are on the same page with some of these people who want more recovery centers, but I still am not hearing what the answer is in the meantime. What harm reduction measures, if not safe supply, if not supervised consumption sites, virtual opioid overdose, it's for opioids, but there's other drugs out there. What more harm reduction measures are you proposing in the meantime?
Well, happily, Alberta has seen a massive reduction in deaths related to alcohol, related to methamphetamine, related to benzos, related to cocaine, related to pharmaceutically prescribed opioids. And so that illicit opioid use is really one of the big problems that we're facing in the province. And that's where the virtual opioid dependency program steps in such an innovative way. And if getting somebody out of addiction for 30 days, where it is biologically and physiologically incredibly difficult to overdose on fentanyl with Sublocade in use, if that doesn't count as reducing harm to advocates, I'm asking them, are you really just talking about safe supply and you're usurping the language of harm reduction and really advocating for harm production?
All right, we've got time for one more, and then we'll wrap up. Operator, put through our next caller.
Next question is from Laura Sharpaletti, CBC. Please go ahead.
Hi, thank you for your time. I'm from CBC Saskatchewan, and this is the question for Minister MacLeod. Minister, we just got some information today that from the coroner's service that 26 people died of drug toxicity between January and March of this year, and another 87 deaths are considered suspected of drug toxicity, ODs. That is a very large number, and it comes at the same time that a protest march was held yesterday in Saskatoon for prairie harm reduction, which is having to close down its hours or make its hours shorter next month because it says it's not getting funding from the government to help with its harm reduction methods. What do you have to say to that number from the coroner's service of just 3 months, 26 people dying? And do you think there is space to both contribute to recovery and to contribute to harm reduction at a place like Prairie Harm?
Well, thanks for the question. I would say that every death due to an overdose is a tragedy. A single loss of life is a tragedy. And that's why the government of Saskatchewan has taken the approach to send the message to individuals that there is help available through treatment and there's hope for recovery. And we're doing that with a very conscious, very well thought out plan to expand addictions treatment facilities to make them more broadly available. We are increasing and improving the access available to those spaces, making it easier for individuals to reach the addictions treatment spaces. And then we are taking the entire approach to addictions treatment and we're shifting to a recovery-oriented system of care that really is focused on wrapping supports around the individual so that we are treating the individual and not the addiction. We need to identify what that specific individual needs, and I would say that what they need is not more drugs. What they need are the supports that will address the underlying trauma. They need the supports that will get them on a path to recovery, and we will follow them down that path on a full continuum of care through the recovery-oriented system.
You have a follow-up, Laura?
I do. So, you're absolutely correct in that wraparound services are needed. One thing, though, that will come up, anyone will say, an expert will say, a family member of someone who overdosed will say, not everyone who is taking drugs thinks they need help or wants to get help. So the issue is, dirty drugs, right? People will argue, like Prairie Harm, that if they offer a safe consumption site, they can then provide those wraparound counseling services that might help somebody get on that road to recovery, as you say, to get to treatment centers. So I'm just wondering about your thoughts on that, on reaching the people who aren't necessarily ready to just go into a treatment center by themselves.
Well, the approach we've taken in Saskatchewan is really multi-pronged. Under the pillar of expansion of capacity, it's not just the expansion of addictions treatment spaces, but also the expansion of services that are available to individuals who may be battling addiction. And those individuals may not yet be prepared or ready to walk the path to recovery. And that's why we've continued to invest in our take-home naloxone program, where 40,000 individuals have been trained to administer naloxone at over 400 locations across the province. Those kits are available. And we've successfully reversed 10,000 overdoses. And that's just one of the many programs that we have. We have the overdose outreach teams that connect with individuals who are battling addiction and have suffered an overdose. We have the community wellness vans that we are introducing that will go out and find individuals who are living a life in addiction and wrap those supports around them early, giving them the supports that they need so that they can put down the drug and find their path to recovery.
All right, thanks everyone. That wraps up the time that we have today.